My research focused on breast cancer translational research and also some clinical sets. The research that I will present here today is on transcription factor known as signal transduction and activation of transcription 3. It's STAT3. It's part of the IL-6 JAK-STAT signal transduction pathway. This transcription factor is usually activated by cytokine from the IL-6 family and translocate to the nucleus in a phosphorylated state where it activates as transcription factors. But in breast cancer, we found that around 40% of the breast tumors are constitutively activated for the pSTAT3 protein. And we can detect it by specific antibody that identify the phosphorylated status of this transcription factor. Now, some studies, or actually quite a lot of studies in the preclinical setting, show that STAT3 is an oncogen associated with proliferation, oncogenesis, angiogenesis, anti-apoptotic, so it is associated with progression of the disease. On the other hand, there are retrospective studies and clinical studies and other studies, not in breast cancer, but in other cancer, that shows that STAT3 has tumor suppressor effects. So actually we're quite in a dilemma whether STAT3 is associated with improved outcome, better prognosis, or whether it's associated with worse outcome. And it's becoming extremely important because compounds that inhibit this pathway are at different stage of development. So we have inhibitors for the IL-6 upstream pathway, for the JAK and the STAT3 pathway. So, and even currently we have clinical trial evaluating JAK1/2 inhibitor, ruxolitinib, in the setting of estrogen receptor positive breast cancer. So actually it's very timely now to evaluate whether STAT3 has good prognostic role or a bad prognostic role, and this was the major purpose of the study that I will present today. We integrated proteomic and gene expression approach and used the pooled analysis with the metagene that we developed using machine learning tools. And this was the first approach. And the second approach was to validate the results in the setting of prospective randomized trial. We used the BIG-2-98 prospective randomized trial and its data for the validation, and both the pooled analysis and the validation set from the randomized trial showed that phosphorylated STAT3 is associated with improved outcome in luminal breast cancer, namely ER positive breast cancer, whether they are luminal A or whether they are luminal B. First, this is an important observation because, as I said before, we are now trying to target this pathway. So I think even if we find it useful to target STAT3 or the upstream JAK2 or IL-6, still we need to take into account the fact that tumors that have activated STAT3 pathway have better prognosis. Whether inhibiting the pathway will be detrimental or effective, this is have to be seen. But any trial that's that evaluating inhibitors of this pathway need to take into account our observations. My take-home message is that phosphorylated STAT3 in luminal breast cancer is associated with improved outcome, and in any trial that is going to evaluate compounds that inhibit this pathway, this should be taken into account as a stratification factor or as a biomarker.